Hello, 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 and welcome. Welcome to Saliva Cast, the podcast that brings science and saliva to your clinical practice. I am Dr. Deborah Heller, your host. I'm a dentist, researcher, and advocate for salivary diagnostics in everyday dentistry. Let's talk about something that has been all over the news and may already be showing up in your chair. Ozempic, originally developed to control blood sugar in patients with type 2 diabetes, it's now widely used for weight loss, often without proper medical or dental follow up. And the side effects are beginning to surface. A recently published report described three clinical cases of patients with absolutely no autoimmune disease and no other systemic conditions who developed significant dry mouth while on semaglutide. That's Ozempic, okay? The only common factor between these three clinical cases, and this study has been published. Let me check the year here for you. It was published a year ago. The only three common thing between the clinical cases was the common factor Ozempic. And why should this matter to us dentists? Well, this absolutely matters because it shows that Ozempic can cause dry mouth and can have consequences in the oral cavity. So let's look at the evidence, okay? I want to bring you the evidence. I want to bring you these cases, and let's talk why. Why we dentists need to pay attention to this? Because dry mouth is way more than just a discomfort. It lowers salivary pH, it compromises natural defenses, and increases the risk of our patients developing erosion, tooth wear, sensitivity, halitosis, caries, gingival inflammation, even in patients that report a good oral hygiene. And this isn't just theory. In my own clinical practice, I've seen a growing number of patients reporting dry mouth without any apparent cause. But when we look deeper, Ozempic use often connects the dots. So, what can we do? What can we do as dentists? What must we do? Well, it starts with evaluating saliva. And we have now a validated method to do so step by step in clinical practice through Saliva Pro. So, analyzing salivary flow, pH, viscosity in the dental practice can help us identify these dry mouth signs, these alterations, and even rule out other causes and act. Because, yes, our patient can use Ozempic and continue with oral health, but we must act. Very important to monitor. Saliva testing does more than confirm the issue. It's truly a factor helping us to tailor our care, our plan to each patient's specific risk profile, and educate. As a dentist, as a health professional, educate our patients. Many patients do not associate Ozempic with oral changes, but when you show them real-time salivary data, they understand and they act. Let me tell you in detail the evidence, the highlights from the first ever published report on Ozempic and hyposalivation. Three cases. Case number one, a 46-year-old woman on Ozempic for 12 weeks reported dry mouth and coated tongue. No signs of Sjogren, okay? The saliva test shows already a reduction, lowering of saliva flow. And in this case, the woman with her doctor opted to discontinue using Ozempic, and saliva flow was normalized again in 4 weeks. Okay, but let's go to the second case. The second case, even younger woman, 27 years old, on Ozempic for 16 weeks, experienced dry lips and dry mucosa. And dentist, we have a clinical exam that we can do in clinical practice to see the signs before our patients notice. This is the oral dryness clinical assessment. We even have a score for that. It's the clinical oral dryness score. Okay, we call it COTS. It's easy to perform. We do with a dental mirror, and it takes less than a minute. So, attention, dentists. It's about time you start doing this clinical oral dryness assessment in your dental practice, in your daily clinical practice. Your patients need you. They are using Ozempic, and they have no idea the impact this has in their mouth. But as their dentists, it is your responsibility. It is our responsibility to bring them this information, to bring them this assessment, and to keep them healthy even when they're using Ozempic. Yes, Ozempic dries the mouth. Yes, Ozempic makes saliva becomes more acidic, makes saliva protect less our patient's mouth. But yes, we can keep our patients healthy even when they're using Ozempic. When we bring Saliva Pro method to our dental practice and we truly start incorporating this in our clinical assessment. So in this second case, the woman comes to the office with dry lips and dry mucosa. And if you're a dentist that do not do saliva assessment, that do not do saliva diagnostics, you may not notice. And no. This is unacceptable. As healthcare professionals, as dentists, it's impossible not to bring saliva diagnostics to our dental practice. But Deborah, how do I do this? Well, SalivaCast is here to teach you, and Saliva Pro is here to bring you step by step to incorporate saliva diagnostics to your clinical practice. In the second case, the woman continued with Ozempic, but the Saliva Pro dentist, they brought the saliva assessment, the saliva diagnostics. They had the diagnostics of hyposalivation, and they started stimulating saliva. In this case, they use medication. There are several options to stimulate saliva in clinical practice, and it worked. It is reported here that the woman improved her symptoms. Saliva improved after 4 weeks. And the third case, Third case, also woman. They're both women, all women, the three of them. 34 years old, healthy, systemically healthy, but it's using Ozempic for 6 weeks already. And it's reporting xerostomia, which is the dry mouth feeling, and halitosis, bad breath, saliva flow reduced. Now I ask you, what if she had come to the clinic of a saliva pro dentist? She wouldn't have come with halitosis and dry mouth, because this dentist, knowing that she's going to start on Ozempic, would come with a protocol to stimulate saliva flow, to keep her healthy. And this is very important, to act early, because your patient that's using Ozempic has higher chances of developing dry mouth. And one thing that's very interesting in these three reported cases, these cases were reported in this well-known journal called Medicine. If you're interested, I can send you this after. Just reach me out on Instagram. It's Dr. Deborah Heller on Instagram. Say, I heard your saliva cast. Please send me the study you mentioned. My pleasure to send this to you. Okay. What's interesting as well is that the onset of hyposalivation of dry mouth occurred around 4 weeks after starting Ozempic, pointing to a possible causal link. While this class of medication, which is the GLP-1 receptor agonists, are generally considered safe, this report urges caution from us dentists. And if your patient listens to Saliva Cast, request saliva diagnostics to your patient. And it urges us not only caution, but also closer dental monitoring. I want to make it clear that most probably Ozempic doesn't seem to be the villain, but it demands dental awareness, and saliva is our early warning system. If you are a dentist, make salivary testing part of your routine. Bring saliva diagnostics to your dental practice. If you're a patient on Ozempic and you're listening to this saliva cast, ask your dentist for a saliva checkup, for saliva diagnostics, because yes, it's possible to use Ozempic and maintain oral health, but this will only be possible with proactive, informed dental care. So dentists do the salivary test, and patient demand the saliva protocol. This is how we practice ethical dentistry with science, communication, and prevention. Let's spread science and prevention. If this episode made you think of a patient or a colleague, share it. I am present here on YouTube. I am present on your favorite streaming app, on Spotify, on all the streaming apps through SalivaCast. And I'm also present on Instagram. Follow me on Instagram, Dr. Deborah Heller, Dr. Deborah Heller, for updates, cases, and clinical tips. Yes, dentists. Yes, it's possible to use Ozempic and protect oral health, but only if we are paying attention and acting early. And this is key. How do you do this? How do you start? You bring saliva testing to your clinical practice You start at your patient's interview, at the medical history. You incorporate validated questions like the xerostomia inventory or the shortened version, 5 questions, and you do it easily. It's very practical and it's validated and has the proven clinical utility. Because the only way to know if your patient is experiencing xerostomia, which is the dry mouth feeling, is to ask them. And you must ask them the right questions. If you just ask them, does your mouth feel dry, yes or no? They'll probably say no. But if you ask them, do you wake up at night to drink water because your mouth is dry? This occurs never, occasionally, always. If you ask them, does your mouth feel dry, but not yes or no, and never, occasionally, always. This brings you not only higher chances of having a true report of their feeling, their symptom, in this case, the dry mouth feeling, but also to quantify it. And this is very important in dentistry, in proactive dentistry, and in prevention. If we have a way to quantify it, and then we go to the clinical examination and we also quantify. We score the dryness, 10 points of attention, visual points. It doesn't go to the lab. You do it right there in your dental chair. I am here in my office, in my clinic here in Brazil. You do it right here, 1 minute of your evaluation. And then you go to the saliva assessment. And I'm really proud to share with you one more study, this time from our research group that we published 2 weeks ago at the Journal of Dental Research Clinical, JDR, our most famous #1 journal in dentistry. I'm really proud to have contributed to this study. And we showed that there is a way to monitor patients in the routine of the dental practice through their saliva flow. And we show in this JDR manuscript. If you're interested, send me a message on Instagram. Dr. Deborah Heller on Instagram is DrDeboraHeller on Instagram. Send me a message. I'll be very happy to send you this manuscript. It's already available on JDR Clinical, okay? So we show for the first time what is the change between a patient's, in between one appointment and the other, that alerts and shows the risk of developing dry mouth. And this changes everything. Because it's not what we were doing up to this publication that we had reference number of dry mouth. Okay, without the patient, okay, you are below the reference number, let's act. I need to improve your saliva, or you're above the reference number. You can be tranquil, like it's all okay. Not only that. Now I can also monitor my patient, even if they're still healthy, because I want them to be still healthy. I want them to continue healthy. But I know exactly what is the amount of saliva that reduces, the change that shows me, pay attention here, that they are at high risk of developing dry mouth. And I act there. This is prevention. This is prevention with prediction. This is Saliva Pro. This is saliva diagnostics in your clinical practice. To wrap up about Ozempic, I want to bring you, what's the takeaway? Ozempic isn't the enemy, but it requires dental attention. And saliva is our early warning tool. Dentists, do saliva tests. Do saliva diagnostics. Patients, ask for saliva protocol. Because yes, it's possible to use Ozempic and protect your oral health, but only if you're paying attention and acting early. Follow me on Instagram, Dr. Deborah Heller, for updates, cases, and clinical tips. And if this episode made you think of a patient or a colleague, share it. Let's spread science and prevention, one saliva diagnostics at a time. Until next time, this is SalivaCast, where your clinical decisions start with a drop of saliva. I'll see you at the next SalivaCast.